Hello, Kaitlyn and Ethan. I'm so excited to welcome you to the IHP Success Podcast. Thank you so much both for coming on.
Yeah, thanks for having us.
Thank you for having us.
Yeah, this is going to be such a fun conversation. I'm really, really excited about this because you guys both run a physical training and physical therapy clinic that incorporates a lot of different avenues of wellness, including IHP education, health coaching, massage, Reiki, lots of different things. And so this is going to be a really, really cool conversation. But first, I'd love for you guys to dive in and tell me a little bit about kind of what brought you to IHP and kind of where you're at right now.
Yeah, sure. So our background, and Ethan can talk more on his side. We both just from a young age, we both were really overweight in middle school. And I think you get into high school and want to impress the guys and girls and lose weight. And both of us, I can say, probably did it in the not healthy way. You go and you run and you just cut calories and eat less. And I know for me, though, that sparked a huge interest in tracking food and nutrition and seeing how it affected the body and starting to kind of experiment on myself from a very early age with some of that. Again, not all the healthiest methods, but, kind of sparked some of that interest as well as just a background in athletics. Decided to go to physical therapy school. Seemed like a stable career where I could also incorporate exercise and things that I loved. And so we went to school at Bellarmine University here in Louisville, Kentucky, which is where we both still live. And we met, and basically our life was 8 a.m. to 5 p.m. school. Then we'd go over to the local gym and work out for an hour. Then we'd come back and study. And it was just fun. Honestly, we loved grad school. We got to hang out with each other all day and just had a blast most of the times. And really kind of how we came up with our business model is, long story short, we fell in love, we got married, went on our honeymoon, and we were sitting there in Cabo by the poolside, talking, hey, so why don't we talk about nutrition in physical therapy school? You get a little bit, but obviously we know the importance of how it heals the body and just recovery and also mental health. And why isn't this all talked about? And so that's where we kind of initially came up with our business model of well, what if we do it? What if we combine, a physical therapy with nutrition, knowing how much that can speed up healing in the body, and vice versa with nutrition, things combining some of the physical musculoskeletal aspects. So that's where Mind Body Physio, it was Bodies by Brown PT at the time, really got started. Ethan, do you have anything to add to that before we kind of go further?
No, it's perfect. Yeah, just kind of again, every different niche within Western medicine, and PT is no different, is just very specialized. And you kind of have tunnel vision on your specific work or your part of the body, whatever it is. And we felt like a lot of opportunity was being missed in managing patients' overall health and well-being, and almost not being able to make progress with certain patients, and knowing that we could if we were able to impact these other areas of their life. And so we just really wanted to start combining more of the things that we already knew about into what we were doing. I was kind of tell the story. It's funny, but when I was in rotations on PT school, I actually got in trouble about talking to patients about nutrition when I was a PT student, because I was working with somebody at a nursing home, and it was a diabetic patient, and they were giving them pancakes and syrup for breakfast, and I was trying to encourage them to not eat that, and I got totally reprimanded by the supervising PT and their superior, just because you're a PT, you can't talk about nutrition. And I'm this is insane. And so just kind of the more that we were decided to really bring everything that we knew about. I've also been a personal trainer since 2009, and, wholeheartedly believe in the amount of health that exercise can bring out too. And just being able to integrate that with the PT component, with the nutrition component, with the mindset component. And it really has just allowed us to help a lot more people in a lot more complete way.
I love that. I think you're so right. So many people plateau if they're only approaching health from one avenue, whether it is the physical therapy side or it is the personal training and movement. It's they will plateau. Maybe they'll start to rebound. And unless you can identify and kind of help them with more of those foundations and root causes, they may not be able to reach their end goal, which I love. So when did you guys decide to move forward with IHP? Because I also noticed on your website that several of your other coaches are certified IHPs as well.
So with the IHP, initially it all started, like we created our business, the physical therapy health coaching. Ethan kind of took the physical therapy side. I love PT school. Nutrition is where my heart is. So I kind of was like, okay, check that off. I'm going to go this route now. And it started more, we both have a fitness background and have competed in bodybuilding shows, competitions. So him more than me, but I have done that as well. And so it started more with like, okay, I have clients and, we manipulate calories and macros and exercise for body physique transformations. And that was great until all of a sudden, I start noticing like, this isn't working anymore. Just cutting calories and increasing exercise. There's people who aren't responding and it's not a compliance issue. And a lot of it kind of started with my own journey as well, seeing from just things that I had done, kind of bringing back to improper dieting methods as a teenager and how that affected me in my low 20s to where I wasn't seeing the results. I was doing all the things I used to do and like feeling like my body was fighting against me, having weird symptoms and weight gain and not really understanding what was going on and being very frustrated, okay, so when there's a problem, what I do is like to dive in head first and explore and YouTubes and podcasts and trying to research like what's going on with me, what's going on, why aren't my clients seeing results? And I think I came across Dr. Cabral on an old Mind Pump podcast. I think that's where I first found him. And I heard him talk and I'm just like, I have to learn from this guy. And I found his podcast. And I just remember every day doing cardio, just absorbing, listening to like every episode and just really aligning with how he talked. I know he always says like he doesn't have a dog in the race, like how he just combines all these different methods and just the way he described the body and the root cause made a lot of sense. So that's where I kind of first found IHP and got into more the functional side of things, if that answers your question.
Yeah, no, I love that. And that's kind of where I came in as well, is I also was a professional athlete and I incorporated and loved sports nutrition and utilizing calories and timing and how all those can make such a big impact in performance and physiology. But it made me really sick. I was eating 5,000 to 6,000 calories a day, but was burning 6,000 to 7,000. And so it threw me into a eating disorder I didn't think I had. And it put my body into a really, really sick state. And it wasn't until I found kind of the other sides of things and recognized that I was malnourished and, I had all these imbalances that I was causing, even though I thought I was doing things right. And that's when I kind of found IHP was I needed to find that missing puzzle piece. And so from all your education, because again, you do the health coaching, you do the massage, you kind of combine so many different things. What aspect of it have you found to be the most valuable and most transformational? Do you work in stress reduction and detoxification? What have you found to provide the most impact? And do you tend to bring people in from the physical therapy side and then recognize, they need more help on the wellness side, so we're going to funnel them to the wellness side? Or is it more, you bring someone in for health coaching specifically, and then you identify, okay, they probably need some help with the movement, and then you kind of push them back?
Yes. Yeah. So from the PT side of things, like the two things that have carried over the most for me has been the stress management component and then the root cause approach. So I actually went on to do, after graduating PT school, I became certified orthopedic manual therapist. And then I've just completed a 4-year manual therapy fellowship with a group called Maitland, which is an Australian physical therapy group that specializes in hands-on techniques. And they are also huge on kind of like a root cause approach. It's kind of a signs and symptoms model, but ultimately you're trying to figure out which tissue structure is generating the symptoms and then trail that back to like, what is the root cause? Like, why is that happening? And it was cool as she was going through her IHP program and I was kind of going through my training, recognizing so many of the similarities. Because I think that we come out of PT school in a way, and I don't know that anyone ever directly said this, but thinking that like the body is wrong and we need to correct it. You know what I mean? And the more training that I did, I was always along the lines of like, the body is trying to accomplish something. I just need to figure out how to help it and how to create a better environment for it to heal itself. But I would use the symptoms as more like clues or trails of where to work and how to work in the body versus thinking like the body had done something wrong and I was trying to fix it. which parallels so much with the symptom approach and diagnostic of the IHP. It was neat to kind of see that correlated. But I think she would say too, and there's so much of the patients that we work with, there's always a component of stress management in some way, whether it's, perceived stress or actual stress, but just kind of in having that educational component to talk with them about, stress is not just one thing. It can be from so many things. It can be stress from your nutrition. It can be stress from lack of sleep. It can be work. It can be emotional. It can be your relationships. It can be, just all the different forms of stress, and really getting the body's internal environment in the optimal place to heal is kind of what we're trying to accomplish.
Yeah. And on the PT side, are you able to do much educating? Because like you said, there's so many different layers to stress. It's internal, external, and there's hundreds of layers. It's like, if you lessen your toxic load, if you lessen your parasite load, if you lessen, all these different layers, you're kind of chipping away at the total load on your body. Are you able to really educate them during your sessions, or is that more, you push them over to Kaitlyn?
Yeah, no, that's the great thing. I feel like at least via the PT route, I'm able to start a ton of those conversations, because one thing I do love about PT is that we just get so much time with our patients. And then our model specifically, everything's one-on-one. We are an out-of-network, we're a direct care clinic. So we don't run through typical insurance routes. We're not ever working with multiple patients at the same time. So like all my visits are a full hour with the patients one-on-one. And I just get so much time to reinforce some of these concepts and to teach them about what's going on in their body and all the different ways that they can kind of, like you said, chip away at that overall picture to get their internal environment in a better place to heal whatever it is that we're working on. It's usually correlated, with some other thing. A lot of times when there's a physical issue that's not healing on its own, it is kind of a symptom of a bigger problem. And that's many times the case.
Yeah, no, that's great. I think that's something I've talked to other PTs and personal trainers about, is they have so much time when they're going through their movements to be able to start to chip away at more of the foundations, and at least start to talk to people about the fact that, you're doing all this movement, you're doing so much great stuff for your body, but are you drinking enough? Sometimes that's the biggest, simplest thing that people can change. And identifying and just having that time with them to just talk is just so valuable. So,
and even just being able to blend in like truly some of the concepts to where I'll have like low back patients that, have had repetitive injuries of, lumbar spine or something like that. And we're working and I'm kind of getting into it, maybe third, fourth visit in, and like, they're just not able to activate their stabilizers correctly, or you can just kind of see, and it turns out you really start digging back in through like diet history and health history. And they end up having like a lot of GI distress and the inflammation around their gut and intestines and things like that's actually what's preventing what I'm doing from being able to work. And so you've really got to backtrack it back. And sometimes they'll go work with Kaitlyn on something like that and then come back to me once that issue is resolved. And then we can make progress fairly quickly. But I feel like it's just given us such a bigger breadth of knowledge and understanding of the body to make sure that we're actually focused on the right target. And it ends up saving people a lot of time and money just because we're able to zero in on the right thing so much quicker.
Yeah, and that's actually something I've personally dealt with. Is I had a lot of lower back pain before I fixed my gut. And when I fixed my gut, the lower back pain went away. And so if you've got that root cause and you haven't, kind of eliminated the root causes in your gut, then it's going to be really hard to get rid of these things. So it's so cool that you guys can kind of combine that without having to refer externally. So you're kind of keeping it all in house, which is, again, a really powerful business model. And it also just provides so much value to your clients, because someone comes to you for PT, they don't expect that they're going to get this kind of full body approach. It's just so much. It's a really amazing, unique advantage and competitive advantage for your business, which I absolutely love. So Kaitlyn, kind of on the health coaching side, what have you found to be, the biggest needle mover for your clients?
Yeah. So what I do is I do all of our intake calls. We do have 3 health coaches with our team. I do all of our intake calls and just pretty extensive, just talking about their goals, lots of just questions. I ask about, their stress and their sleep and the support they have and just their background with, other things they've tried. And I can get a pretty good read for the client, for their personality. You can kind of feel their energy even through those phone calls and maybe where they're at and what they've been struggling with. And especially as we've moved, we started very much like the physical body and how we manipulate nutrition and exercise and supplements. And then Ethan and I, through our journey separately and also as a couple, have moved a lot into like the mental side, the spiritual side, and just knowing kind of the importance of those aspects too. What I try to do in those phone calls is just decide, stress is the biggest thing, right? And so that can be like the whole rain barrel effect, right? It can be mental, emotional, it can be physical, like you mentioned your situation and mine, like almost an over-exercising, malnourished situation. It can be toxin exposure. And I try to figure out kind of the biggest domino to where, by all means, like the detoxification, like huge if I have clients that I feel are in a place to go through a detox. But there's many clients I talk to, and honestly, and they're super the type A, maybe previous eating disorder type and stuff. And honestly, if I threw them into the protocol or a big detoxification with all these supplements, I think it might actually put more stress on them first. And I try to actually simplify. So it's very client dependent, but it's really just modulating that stress. And for some, we do jump into a detox. For some, we start with like, hey, you're going to, I don't want to list any names, but some of these HIIT classes that females are doing, males too, but I tend to see a lot of, females 30 to 50 type A who have just been overdoing it for too long and now their bodies are fighting back. And can we take that down to 3 times a week instead of 6 times a week? Can we try some walking with some weight training and just kind of like modulating some of the physical stressors, as well as the mental, emotional where I can. But definitely the detox is huge. If I see anything coming in, autoimmune or gut, I always try to open up those pathways first. And I find that clears up a lot of things or moves the needle quite a bit. So detox and stress, whatever that looks like based on that intake call with the client.
Yeah, I think I've seen the detox to be so powerful as well. But you're right. And I like that you brought up that for people who maybe have had eating disorders in the past or are struggling with making sure they're eating enough. You guys also work with a lot of people who come to you for physique, which is a really interesting niche. And that I'm really curious about because when, you're going into physique, they go through big highs and lows and swings of the amount of calories they're putting in. And I'm curious, that puts a crazy amount of stress on the body. How do you manage that with the wellness side of things?
100%. And this is where we love what we do. Cause combining some of the functional and autophagy work with some of the physique side that bodybuilders, there's so much you can learn from bodybuilding because they do both in such extreme, the pushing and the building and the mTOR, and then, some of more of the I get really autophagy, right? Cutting for a show and how lean they get. You can learn so much from watching how they experiment with food, nutrition, even hormones and peptides and things like that. I will say I have a couple different types of detox systems I use. So very much some of the protocols I've learned through Dr. Cabral have just been so amazing for my clients. And then I have another type of system that I actually use for my clients who have been more under eating and more those physique types and whose metabolism is super downregulated. And it's actually a little bit of a higher calorie approach with lots of just simple, easy to digest foods and carbohydrates. And I'm able to, within some of the detox supplements I use and the specific kind of macro ranges, types of things I'm using on the body, get their metabolism up very quickly to where we can start in almost like a metabolic priming phase before we worry about fat loss. And oftentimes from reducing inflammation, their blood sugars are more stable, they're sleeping better, less stress on the body. We are kind of getting a physique recomp in the process, but usually I'll kind of pick between those. And a lot of times I might actually go the opposite way before going more like a low calorie autophagy route, if that seems warranted for the client based on where the metabolism is at.
Yeah, that's so interesting. And the physique world is really interesting for me. I've worked with other bodybuilders, and like you said, they go in such extreme highs and lows, extreme fasting, extreme, putting themselves through dehydration. And how do you kind of help them rebalance the body outside of competition?
Yeah. And I would say I don't work with a ton of straight competitors. So I use a lot what I have learned from being a competitor myself, from learning from a lot of like mentors, who have kind of combined also like maybe a little bit of physique with some of the functional and things. But a lot of times too is just encouraging that health phase to where like, hey, we don't have to you're actually going to, I would say, showing people through results that, hey, actually having some time in a health phase where we're not pushing either one of these pathways, growing or cutting super hard, is going to actually allow you to have a more responsive system. And usually people who are extreme in physique, they might not listen or believe you until they run into issues. It's like that pain point has to be enough to where finally, hey, I'm not getting lean enough for my show, or hey, I'm gassy and bloated and constipated all the time, or I'm having all these GI issues from pushing food so hard for so long. And eventually they end up coming around once they start having those problems, which anybody who's pushing any of those pathways too hard for too long, except for some genetic elite people, which isn't most, start to have those issues. And then their mind is open and they're starting to listen. And so then they might go through like a health or a physique or a gut phase with me or something like that, where I have had that happen where, somebody works with a bodybuilding coach and then their coach is specific for bodybuilding physique and doesn't have some of these functional knowledge. And they'll kind of kick to me where maybe I help them with their gut and they don't have any physique goals in mind for a period of time. And they're in a healthy spot to kind of go back to that coach.
I think too, it's about, changing the mindset sometimes of the people that you're working with. Like there's always kind of the understanding, and you do have to have that talk with physique clients that like, look, health goals and physique goals are going to like be traveling in the same direction for quite a while. But at some point they do kind of deviate. Like when you're in a physique competition, at some point you are like moving away from health to make more progress towards the physique goal. And that's fine within a, time container. But I think one of the things that we've gotten a lot better at is like really being able to identify where the threshold is with each person and like identify how much they need. Like one of the more recent prep clients that we worked with, it was his easiest prep by far. And he was like feeling guilty through most of it because he just didn't feel like he was working hard enough. He ended up looking the best he had ever looked. He won his class. And it was like, we were much better able to identify like how much do you act. He would have, if he would have left to his own devices, would have been training, 7 days a week, cutting his calories and like through our understanding of functional health and things like that, we were able to just really dial in what was the optimal amount of training given his stress level at work, given his stress level at, all these other life components that kind of get thrown into the mix, knowing other health variables for this individual, knowing what he was doing with his diet and just able to dial all those things in to where there was no wasted energy. And I think so much of physique clients, there's so much wasted energy because I feel like there's a lot of guesswork in being like, oh, I'm just going to up my cardio more. I'm going to add another day of lifting. I'm going to drop another 200 calories. I'm going to drop my carbs out this week. And you can do that for a while, but like she said, the body starts pushing back. And so I think during, cutting phases, we're a lot more able to reduce the stress that's being put on the individual. And so that we don't have to swing as far during the cut phases. And we also don't have to swing back as far during the rebuilding or reverse phases for that individual either to restore their optimal health.
Yeah. And we're big on like, we know our clients like very, very well. Some of them are good lifelong friends at this point, which some people might say boundaries is a business model, but it works for us. We love our clients. And again, a lot of them are very long-term, end up being good friends. But, we try to encourage, again, that kind of middle health phase. But at the same time, that is where like, obviously manipulating, like Ethan said, with the exercise, and then also with the nutrition, like, refeeds and things like that come a lot out of the bodybuilding community, recognizing when that's needed, when we have reset days. But also I would say like when you're pushing in those extreme, supplements become even more important. Things like adaptogens and stuff from a stress control, especially from like the hormone side too. If you have natural competitors who are not on like any kind of like hormone replacement, is controlling, like progesterone, things like chasteberry and stuff to help with like cycles and keeping a female cycle throughout a cutting phase. And not even just like a bodybuilding competitor, but really any female who's wanting to push their physique. I utilize things like that to help from a hormonal standpoint, or after a hard cut. A lot of times what we'll see in the fitness industry is somebody goes a hard cut and then, progesterone's tanked, testosterone's tanked, estrogen's tanked their low hormone. And then we see them start to go really estrogen dominant, and estrogen being the first hormone to come back. So I try to help support, controlling that while also, testosterone, progesterone coming back on with more natural herbal type supplementation. So there's a lot of supplement work that we do too with the adaptogens and then some of the hormone side to help when somebody is pushing those extremes, or even with just lifestyle clients who are also really experimenting with their physique.
I think that's the fun part, is like, because we started sort of in the physique arena and then have moved more towards like the health arena, like we learned how to do the physique component as healthy as possible. But now when we have people come to us that are just like your average lifestyle client that want to lose 10 pounds, we're like, we got you. You know what I mean? Like, this is not going to be hard at all. And like, we can keep them super healthy throughout that process.
Yeah. And I think that's what's so cool about your business model, is because you come from the sports background, you can combine that knowledge. And so many people come to wellness, coaches because with the goal of losing weight, or it's also health, but weight loss is often one of the primary goals. And because of your backgrounds, that's kind of one of your specialties, is you can combine stress reduction and all the different aspects of wellness, but also help them reach that goal faster and easier than they can pretty much find anywhere else, because you also work in metabolics to that. And that's something that almost no one understands. It's really, even with health coaches, the metabolic side, keeping your metabolism high, keeping, things moving and fat burning, as opposed to moving to burning almost pure protein if you're, not eating specific macronutrients. That's such an important thing. Go ahead.
I was going to agree, especially that like protein adapted kind of, we're seeing that more and more too. And that's becoming, especially like a lot of females who have just pushed it and done the low carb too long, too much stress on their system. I think we use a lot from like kind of the two different worlds, because I do see, and that's why I love Dr. Cabral too, because he talks about both and the importance of both. But there are a lot of like longevity people who just push autophagy so much. And people end up losing a lot of muscle, metabolism super low to where, they're eating 500 calories a day, and that's their new maintenance. And there's like a quality of life thing too component, and a realistic component of people to balance. And so a lot of our health coaching clients, for example, are with us a while, and we go through phases where we have cutting and then we reverse diet and build. And maybe there's a health phase, thrown in there too. We check in with our clients every single week. There's touch points too. So we're able to make a lot of those like small manipulations and have a very tight control over what they're doing on a weekly basis.
Yeah. And I think just again, like that understanding of knowing who to push and like how much to push and when to push or when to pull back in terms of exercise intensity, in terms of caloric restriction, or in terms of like all those different variables has just really helped us kind of dial in. Because just being able to look at, and I know Kaitlyn can call me out on the Vata Pitta Kapha versus endo ecto meso, but I'm going to speak in the terms I know. So, if you take an ectomorph, like you've got to watch their training volume. You're just going to beat them up. You know what I mean? If you put them into too much physical activity and you cut their calories too much, like you're going to burn out their system. Versus an endomorph, you can give those gals a lot more volume. And you're really going to see, you won't see the same effect. You'll see good results with that, and you can restrict them more. So just having that 100-foot view that I feel like a lot of coaches may not have, that have just entered more into the physique categories, and they know the macro manipulation, but they don't really fully understand some of the bigger health components, or, that has helped us a ton.
Yeah, I think that, again, is so important, because most people look at macros. They're not looking at the vitamins, the minerals. They're not looking at the building blocks to cells. Like, if you're not providing your cells the building blocks, then how are you going to create new muscle? And if you're not fueling at the right time, you're going to kind of go backward with a lot of your work. And so again, I just love how you kind of put all this together. And one of the things it sounds like is that you guys have a lot of long-term clients. Yeah. And so do you utilize more of the, one-off appointments, or are you creating multi-month programs, memberships? Kind of, can you share with us what you do there?
Absolutely. I'll go ahead and take that from the health coaching side. The PT is a little bit different, but essentially, we have our intake call, and I will decide kind of like, hey, is this a client that's best suited for me? That's another thing we love that we can touch on within our practice. We have multiple PTs with different specialties. Same thing with our health coaches. So we very much match the client with the best provider. But all of our health coaching, we have different options. We have month to month. We do have a 3-month minimum just to make sure we have enough time to really work with that client. We have some 6-month packages and other things, but essentially how it works is, we help our client to create a healthy nutritional program, any supplement recommendations, exercise routine, and then we're checking in with them. We have some, documents that they fill out on a weekly basis. We have progress photos so we can see visually what's going on. And every single week we're touching point with that client. We're going over their check-in documents. We're giving them feedback on adjustments and changes we're making. So everything is weekly check-ins. And then, some clients might just need that 3 months. Other clients I have some clients that have been with me for years, and they just love working on different aspects of their health, plus the accountability, and they have different goals because there's always just new things to be striving on and working towards. Especially a lot of our clients just tend to have that curiosity towards their physique and longevity and, hey, what about this? What about that? And we just have those really good relationships with them.
It's been really cool. Yeah, we've got, and on the PT side of things, so it's a little bit different. I also do, I would say, at least right now, about half of my caseload is actually like higher level training clients. So people that are kind of wanting to combine, physical therapy knowledge of the body with training, like they've had prior injuries or they've gotten injured working with trainers in the past, and they're just wanting to incorporate more of that side of things within physique goals. And so I've got a lot of those clients that I've worked with for a pretty long time. But I've got clients that I work with 4 days a week. I've got clients that I work with once a month. I mean, it's all over the board. And I've kind of I'm not like technically taking new patients. So I've kind of gotten more creative. If people want to hop in and work with me on like how I can write them up a program, I do 1 day of each of their program days one time with them. And then I sort of send them on their own and they can come back for a checkpoint. Different things like that we've sort of created down the road as time got a little bit more limited. But it's really cool to see, especially a lot of the clients that work with Kaitlyn and I both, like we've become their like general health counsel. Like it's really just neat, and it really motivates us to continue to kind of stay on top of our game because, we're the ones that they're turning to over their doctor, over any other professional that they're seeing medically. Like they just have that trust in us and that faith in us, and we haven't let them wrong. But it's really like, it's been super rewarding for us from that side of things to be able to impact somebody's life on that level.
Yeah. That's so amazing because that's what every health coach needs to hear. They want to hear that it's not just the one-off appointment. This is about creating lifetime customers to where you're going through the different phases of life with them. Every 3 months or every 2 months, they could have a totally new goal, and you become the go-to people that they trust and the authority. And so if they want a new goal of learning how to sleep, or they want to, become an athlete and, you become the authority, they're going to come back to you. And so that's what, as the director of success for IHPs, I'm trying to teach them is that it's really about building that relationship and creating that trust and showing them that you can help them with more than just the one-off appointment, because that's really not enough for anybody. Is a lot of people, you can give them a program, but to help them keep moving to their goals and make them truly successful, you need to have more touch points and you need to be able to kind of help them on that journey. So I love that you guys have kind of created that model. And at this point, based on your website, it looks like you have many different coaches. I guess, where are a lot of your customers coming from?
Yeah,
it's mostly, go ahead, Kaitlyn.
Yeah, mostly I would say 80 to 90% word of mouth at this point. We do have a couple physical locations, and that is for our physical therapy and massage. All of our health coaching is virtual. I would say probably like 60-70% of my clients are not in Kentucky. But so that's helpful. We do have some physical locations where people see our name, know that we're there. But honestly, most word of mouth. I'd say we try to go above and beyond and just really have some great relationships with our clients and try to always over deliver. And so we really don't put too much into marketing or advertising. It just kind of full circle comes around from a word of mouth aspect.
Yeah. We've gone through different phases where we were like, oh, we should definitely market more. And then like Honestly, and there's nothing wrong with that. There's really not, like, but every time we've just seen that, like, when we put that money back into ourselves and our education and our overall product, that is the best advertisement that we can do. Like, every time we work with someone, that leads to us working with 2 more people. And it's just, that's how it's grown.
Yeah, that is absolutely the number one way to grow a business, is to treat your clients absolutely as well as you can and provide them as much value and help them reach their goals, that they just become raving fans and referral machines. And then you're turning, you have to turn down business because everyone wants to work with you. And it sounds like that's the business you guys have created, which is incredible.
Yeah, I mean, that was even like 3. Go ahead. I was just making that joke. 3 years ago, we changed our name from Bodies by Brown PT because I was like, I got to get my name off the door. I can't work with anybody else. Like, it was like, and we changed it. That was part of it. Mind Body Physio was just, we felt like better aligned with our vision, but we needed to kind of spread out the referrals that were coming in, and it's been really good.
And one thing I would like encourage too, other people trying to start their own business and stuff. And again, I don't consider myself a business person. I consider myself a really good health coach. But one thing I can just speak to me personally, and other business people may differentiate or have a different opinion, is we are open with our clients. We are very vulnerable. Like, I, again, work with a lot of women who are me, essentially, to where I've had a lot of the same issues, a lot of the perfectionism, overdoing it, obsessing with the scale and their bodies and histories with things like that. And again, males too. I work with males as well. And I've been very open with them. I've been very vulnerable with them in regards to my journey and things that I've done, and very honest. And it's not some of that cold relationship, but it's a very warm, kind of loving relationship almost with my clients, which allows them to trust me because I'm opening up to them. They open up to me. And then, a lot of those things that they end up sharing actually are really important for me to know, to help them. And I'm able to help them, and might be some of the first things we work on that aren't even nutrition related.
Yeah, I think that's so important, is being able to and willing to share your story, because it will bring out more in your client. They will, like you said, trust you more, and they'll relate to you, even if it's on the smallest thing, but that's going to build more of that relationship. And again, that's where they'll share things with you that maybe they wouldn't originally. And it's that one core piece of data that you need to understand and recognize maybe some of the root causes, because, there's so many foundations that if their foundations are missing, how can you optimize health if you're missing core foundations, right? If they're not drinking, if they're not, eating the right things, if they're deficient in 5 different vitamins that'll have a cascading effect on everything else, and recognizing, oh, you're only sleeping 3 hours a night, where maybe they wouldn't even have thought of that as being something. But if you share your story and say that, I did this wrong. I did this wrong a long time and it made me sick. They will just be so much more willing to share. And I just think that's so important, even on not just on the one-on-one, but in the marketing side of things, is people are going to connect with you more. You're going to reach a bigger audience if you're willing to be vulnerable and share that side of you.
100%. And that's what I love too, that I'm starting to see, is I feel like just, and part of it's social media and stuff, and just amazing people out there like Dr. Cabral. I've learned from some other mentors too, of just opening up, sharing, being vulnerable, and then social media, how we can reach so much more people. Is I'm starting to see younger females and males now too, who are open to this concept of hey, let's not diet. Let's focus on fueling our body. Let's eat more. Let's focus on, these other aspects of health. So it's really cool for me to see some of these younger populations being open to it as well. And kind of shifting maybe what some of all of us did, which run our butts off, don't eat any carbs. So that's been exciting and encouraging too, to see.
Yeah, no, I totally agree. And, I've got kids, 10-year-olds, who are actually asking their parents, hey, can I do that protocol with you? I see how much it's helping you. Can I jump in the sauna? It's opening their minds because, parents are bringing it home. Or like you said, people are seeing things on social media that are opening their mind to the fact that they don't have to feel like that, because people are getting sicker younger. And especially in high school, you're pushed so hard in the sport that you're in. If you're an athlete, you're pushed because you want to get into college. It's one of the best ways to get into college in certain situations. And so there's so much pressure, so much stress, so much, performance anxiety that's being caused. And at that point, most high school athletes are not doing things right. And that's when I started to get sick, because I was pushing myself so hard. And that's just so common. And the fact that they have access to all this information is going to change the game for them. And we're going to start seeing people healthier younger, as opposed to people, in the past, maybe haven't started to even think about their health until their 30s or 40s when something starts to go wrong. So now that's being pushed younger. And I think that's just such a powerful thing for kind of changing the health of generations, is if we can push that back 10 years.
100%. And that's what we try to do on our social media, is just like be so kind of tying that back into like just being open and sharing your story and being vulnerable, because then you do get those people who start to listen and again, trust you, and then, hopefully avoid some of the issues that we all had to work hard on to overcome.
Yeah. I mean, Kaitlyn started to work with people at a younger and younger age, just on the stress management component. I've seen, from the PT side of things, I've had a lot of young athletes come in that I just could recognize that what was going on in their body, like while there was a physical thing going on, it was kind of an expression of the body breaking down already in a way. And so sending them to Kaitlyn to really work on like making sure nutrition was dialed in, making sure stress management, as much as it can be done, was tied in, at least so that they have an outlet for parasympathetic time that they may have not really understood that they needed. That's been huge as far as helping them, with their overall picture.
Yeah, absolutely. Well, guys, this was so incredible. I'm so happy we got to have this conversation, because you guys have such a unique approach, and you've got a really successful business that combines so many areas of wellness. And obviously you have the right kind of combination that's helping people find success. And that's really what our goal is. All health coaches, that's what we want, is we want people to get healthy, and we want to help them improve their health for the rest of their lives. And you guys have kind of created that in this multidimensional business you've created. And it's just so incredible. Thank you so much for both being with us on this podcast. Our listeners are going to love this episode. And if people want to learn more about you or connect with you, where can they find you?
Yeah. So, and thank you for having us on. Thank you to Dr. Cabral. And just like, again, he kind of is who started all the functional stuff for me, and it's just been amazing to incorporate that together with Ethan and our business with our other practitioners. But the best way, we're on social media. It's at Mind Body Physio LLC. Anybody can also email us. It's optimize@mindbodyphysio.fit. It is .fit, not .com. So people make that mistake. And then our website, www.mindbodyphysio.fit. But we're very responsive on our social media. It's us who runs it. So anybody can DM us, get a quick response. If there's anything they have questions on, want to cover, email us for any inquiries, and we can set up a coaching call.
That's amazing. Thank you so much. And thank you to the listeners for joining us. You can subscribe or, follow us on any of our platforms. And we've got a lot of amazing episodes coming. So I look forward to seeing you then.
Thank you.
Thank you so much.